Can I ask you a question, Larry?
Yes, you may.
I actually might have two questions if I could remember the second one after I ask you the first one, but
Write it
um,
down.
would you, I know, right? Um, do you have any tips on how how did you handle, or do you have any tips on how you managed some of the stages of grief that you went through? Was there anything in particular that kind of stands out?
Well, I think that, and this would go back to probably um, the earlier portion of my disease, uh, as as uh, as things started to deteriorate, cognition, balance, all these things that were starting to go wrong. Other people saw it, and I was like, "No, I'm fine. I'm fine. I'm fine." So I think I went through a lot of denial before I developed the some of more of the anger, and um, I think I just spent time. You want everyone to see you as okay. Everybody does. Problem is that, and because of that, I think that you don't recognize yourself what everybody else sees in the early stages. And as it progresses, as you know, you get to a point where you can no longer deny that this is happening. And so that's, I think, when you start getting more of the anger and frustration, and uh, I mean, in the bargaining piece, I don't know how I would explain that.
Is
Other
there
than
is there any way that you can think of that a caregiver could approach or handle their loved one who is in that denial stage? Like, should they stop bringing it up and talking about it? Like, how is there anything that would help you during that denial stage from the care person's perspective? Or do they just kind of have to get through it themselves?
I would have to say hindsight's always 2020.
Yeah.
Um, in One thing that I've done is I've done a lot of homework on exactly what's happening to me, and I think that um, perhaps had my physician or someone had said, look, I think that this is what you're dealing with. Had I known it sooner and known more about the disease sooner, that might have helped. I don't know. I think that by if you're newly diagnosed with Lewy body, I think the one of the things that you have to I would suggest to people is educate yourself as to exactly what Lewy body is. Educate yourself on what things you're going to have happen. I actually found another resource very helpful. It was a booklet on how to communicate with my physician,
Oh.
what's happening,
Hmm.
how to have those discussions, what kind of information do they really kind of need. And I've actually talked to a doctor about coming on to the podcast to discuss just that.
Mm-hmm.
What what kind of information helps you? Does that answer your question?
Yeah. Thank you.
You sure?
Yeah. Because I think a lot of caregivers, they want to help in the right way, but sometimes they just don't know how.
And that has been, and I think you and I had a discussion about this. My wife started to rearrange the kitchen,
Yeah.
and and she didn't realize that how much confusion it was going to cause for me. But when I talked to her about it, and I think you have to come to the point where you've read enough about what's going on with yourself to understand that you need that consistency, that you need, and so now I can be calmer in my approach to say, look, this is what's you're doing this, and I understand, but here's what it's going to have on me. And she's like, I didn't even think of that. Of course you did it. You've never been down this road either.
Yeah.
But I think I guess my point there is that if you understand what you need to try to help, you know what I mean? From
Yeah.
educating,
Yeah.
and understanding what's going to help you, and being able to communicate that in a calm manner with the person who's uh, helping you and caregiving for you. Um, Keep it away from the escalated into a confrontation.
Yeah. That's important. That's
And
important.
I think that's got to be hard for the caregiver to walk that line too. But I think that's very important. It's just to make sure it doesn't escalate into a confrontation.
Larry, did you go through any like guilt or loss of like feeling like the dreams of your retirement years or what the two of you, maybe what your retirement looked like, that was just shattered or like that's just not going to happen now?
Oh yeah. Oh yeah. Yes. Yes.
Because I
Uh,
think we all
I
kind
mean,
of think about our
that's
retirement and then all of a sudden it's just like, well, that's
that trip
gone.
that trip down the rabbit hole is I lost my job. I'm not capable of holding a job. I've lost my purpose. Why am I here? And what am I going to do to my loved ones? Mm, Everything's changing. Everything's going to change. And the burden that you are going to place on others is a very, very difficult. And pardon me, but I may get a little emotional. But that is, it's difficult. It's a hard pill to swallow, and that is all down in that rabbit hole, in that pain button, in that box.
And the
And
caregiver feels that way too. So the caregiver has lost their retirement with
with
their loved one.
what they thought they were going to be able to do, right?
But does the person with dementia like you, do you feel guilty like that you're robbing your spouse of that as well? Like, are you getting the double whammy? I just thought of that. Like, I didn't even think about that before.
I think that you have those feelings, yes, but I think coming to the realization together, me and my
Yeah.
wife, that 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 this is a journey. It's changing everything that we thought, but it's still a journey that we're going to take together.
Yeah.
And I think that is where the relief comes from feeling guilty. And my wife tells me this uh, frequently: "You didn't choose this. You
Yeah.
didn't ask for this. Neither one of us did." So I
It's out
think
of
that
your control.
yeah, yeah, and
Yeah.
so that brings you to that more of that acceptance piece,
Yeah.
you know, and
Larry, you said something. I'm sorry to interrupt you,
go
but
ahead.
you said something that really, really resonated with me, and I want to touch on it. And it was something about um having a purpose,
Mhm.
right? And I think that that is kind of one of my superpowers in my training is how I teach the care person how to help the person with dementia feel like they have a sense of purpose and belonging.
I think that that is important for everyone to have a purpose. And
Oh,
when I had that conversation with my therapist, she was like, and I'll be perfectly honest with you, Deborah, I have no idea where the idea to do this podcast came from. I don't. And she came one day and I said, I think I might have thought of something I might want to try to do. And she said, what's that? I said, I think I would like to maybe start a podcast and share my journey with the world and share what I go through and allow others to come on and share their story and anyone that can help to raise awareness and when I had cancer, Deborah, I was at John Hopkins Hospital, which is a learning hospital, and there's a lot of students running around, and they ask you, "Can we take extra tissue samples for, uh, studies that we want to do in the classroom? And can we do this? Are you willing to do this? Willing to do that?" And I was like, "Yeah, learn all you can, learn everything you can." Because you don't know what is gonna happen that's going to make someone else behind you's journey better, and I kind of thought, "Okay, that's kind of what I want to do here," and I told my wife, I said, "Look," I said, "I have the, audio experience to be able to produce it. I'm not gonna have production costs and things like that." I said, "And if I can help one person, one, it will be all worthwhile." And I have helped hundreds. And
thousands,
yeah,
thousands, Larry,
yeah,
thousands. And
it's
we're gonna hit thousands, thousands more.
right. And so that then became a place where I feel like I have purpose. And I think that everyone has to feel like they have a purpose.
Right,
I think if you
right.
have no purpose, why are you here?
Exactly,
And
exactly.
when you start asking about why you are here, you're going down a whole nother rabbit hole that isn't so pretty.
Yeah.
And I really think that people who lose the purpose and can't find a purpose and they lay down and they accept their what's happening to them, I think they deteriorate at a much faster rate
Mm-hmm.
than someone who says, "Okay, I don't have the same purpose, but I can find one." And then once they found it, I mean, even if it's volunteering or something, I mean, everyone can find I think, a purpose. It's helping that person to find a purpose.
Yep,
I kind of stumbled into
yep,
mine,
yep.
but helping that person find the purpose so that they have some meaning to stay here.
Yeah. And that's, Larry, that's one of my superpowers in the course, like behaviors, communication, and helping to give that person with dementia their power back. And it circles back to like when you were saying about, celebrating successes.
Hmm.
And it's so important. And I think that that's a piece that's missing sometimes for caregivers because they're not sure how to do that. And I can show them how to do that. And
Right.
I just, man, Larry, today has been great. I've really enjoyed what we've covered today. I think is really going to help a lot of people.
Just a second here. I'm looking at something real quick. Da, da, da. Yeah, and I know that your course that you have that is that certainly I know is something that's helping a lot of people. I
Yeah. It's my
eh,
life's work all wrapped up in a nice little bow for anybody who's willing, you
well,
know?
when I said I wanted to help one, and we are we are helping thousands, and it's across the globe.
Yeah. Yeah.
We're on six.
Congratulations, Larry. Congratulations.
It's
Mission accomplished, dude.
well, it's not accomplished yet, but we're
Well,
working
we're
on it.
still going. We're
And
still going, Larry. We're still going strong, you and me.
yeah, and I think that it's very important to continue that mission. That
Yep. Yep.
I've talked to people. I had a woman reach out to me very early on, when I started the podcast, because I started talking with a guy in Kansas.
Mhm.
I'm in Maryland. He's in Kansas, and he reached out to me. He wanted to tell his story, so I usually will have a conversation with them before I actually bring them to recording because not everybody's used to how things are going to sound
Mhm.
and or how that's going to go. So you kind of want to give them a little brief on how things are going to go. And so, at any rate, um, it was the first time either one of us had talked to someone else with Lewy body. What a
Wow.
powerful conversation.
I bet.
Then I got a message from someone that said, "I've never talked to anybody with Lewy body. Would you mind calling me?" And on the other end of the phone was a 78-year-old woman in a nursing home in Idaho. And at the end of our conversation, she said, "Young man, you just made my day."
Oh,
And I
isn't
said,
that the best?
and I told her, I said, "You made my day." But
Yeah.
that's that's when we know we're doing what we're supposed to be doing.
Mhm.
So you're going to tell everybody about your course?
So, yes, sure. Thank you, Larry. It's called the Certified Master Dementia Strategist course. Very soon it will be available online, but right now I'm doing it live on Zoom in person. And it's absolutely phenomenal. So you can go to answersabout.alz.org to get more information or book a call so that we can figure out if it's the best decision for you.